Jamaican women now have an average of 1.3 children over their lifetime. To maintain a population stability, we need 2.1 children per woman. That difference may sound small, but for Jamaica, it is massive. It affects our workforce, our economy, and the very structure of our society. Welcome back to Building Wealth with Wisdom. I'm your host, Adrian. Today, I want to explore a question that sits on the intersection of health, economics, and national development. If infertility is a health issue, why is it not funded? Because how a country treats fertility care reveals how serious it takes its future. Now, high quality fertility care is a core pillar of reproductive health. Yet in Jamaica, it remains largely absent from public policy discussions. Cultural stigma around infertility often forces individuals and couples to suffer quietly, bearing emotional strain and heavy financial costs in silence. And in a country where health insurance coverage is limited and private financing options are scarce, fertility care often becomes a privilege and not a right. That reality deserves urgent attention. So why does this matter for Jamaica? Well, Jamaica's decline in fertility rate has reached crisis levels. According to the United Nations Population Fund's 2025 State of World Population Report, Jamaican women now have an average of 1.3 children over their lifetime. To maintain population stability, we need 2.1 children per woman. That extra 0.1 matters. It reflects the reality that not every child survives to adulthood, and slightly more boys than girls are born. In simple terms, above 2.1 populations tend to grow. Below 2.1 populations age and decline. In Jamaica's case, Jamaica is firmly below that line, and this gap matters because declining fertility affects our future labor force, economic growth, pension and social security systems, and long-term national development. Put simple, fewer people today mean fewer workers, taxpayers, and caregivers for tomorrow. But let's back up and do an historical reality check. Ironically, Jamaica once faced the opposite challenge. In the 1970s, the National Family Planning Board launched the Two is Better Than Too Many campaign. Anybody remember that? Well, at the time, women were having about 4.5 children on average, and the goal was to slow the growth of the population. By most measures, the campaign was a success. Well, perhaps too successful. Today, fertility has fallen below sustainable levels, and Jamaica must now confront a new demographic reality, one that threatens population stability. Globally, in November 2025, the World Health Organization published its first ever global guideline for the prevention, diagnosis, and treatment of infertility. The WHO made a striking observation. Despite advances in sexual and reproductive health globally, many countries still exclude infertility from health policies, financing frameworks, and service delivery systems. Although some efforts have been made, Jamaica reflects this global gap. Public funding remains limited, support systems are weak, and the national conversation is still subdued. Now, let's be clear. Infertility is a medical condition. It affects both men and women and is defined as the inability to achieve pregnancy after 12 months of regular unprotected intercourse. Globally, 1 in 6 people of reproductive age will experience infertility at some point. Yet, access to care is often determined not by need, but by cost. And there's a barrier to it. Fertility services, including medical assessments, medication, surgery, and assisted reproductive technologies like in vitro fertilization, IVF, can cost hundreds of thousands and in some cases millions of Jamaican dollars. And guess what? Most of these expenses are paid out of pocket. And for many Jamaicans, that makes fertility care simply unattainable. So we must again ask the question, if infertility is a medical condition, why is it not funded? Why? But there are also broader pressures and things to consider. Socioeconomic realities further complicate the issue. Jamaica is facing higher cost of living, limited access to affordable childcare, and of course, there is delayed childbearing due to education and career demands. Then there is migration of skilled workers and a high number of single-parent, female-headed households, and this is often estimated at 40 to 50%. Infertility is also linked to poor mental health outcomes, strained relationships, and the persistent social stigma. And this often is borne disproportionately by women. Now, these challenges are not isolated, they are deeply interconnected. But to be fair, the revised National Population and Sustainable Development Policy was launched in July 2025. It does acknowledge infertility and affordability of fertility care as priority issues. That is progress. But policy recognition alone will not change outcomes. If Jamaica hopes to return to replacement level fertility by 2030, we need more than good intentions. We need decisive financing and implementation. So, what should be done? I'm recommending 3 actions. First, Jamaica needs a public fertility care financing policy to support prevention, diagnosis, and treatment. Secondly, sustained public education campaigns need to be a thing, and they should be focused on early detection, treatment options, prevention, and stigma reduction. Third, a broader national dialogue needs to be had in terms of bringing together public and private sector stakeholders to address the financial implications of fertility care. In the short to medium term, public financing must lead, with a gradual transition to a public-private model over time. And in closing, investing in fertility care is not just a health expense, it is an investment in demographic stability, economic resilience, and social well-being. If we are serious about building wealth, not just for individuals, but for Jamaica as a nation, then fertility care must be a part of that conversation. This has been Building Wealth with Wisdom. If today's episode challenged how you think about money, policy, and Jamaica's future, share it with someone who needs to hear it. Let's keep building wealth, not just for today, but for generations to come. Until next time, walk good, stay safe, and build wealth with wisdom.